24, Dr. Edward Shouldice, a Toronto surgeon, performed emergency hernia operation on Canadian servicemen. Because beds were scarce, the men were on their feet within 24 hours. Some were back fighting within 2 weeks. And this was all in direct violation of medical theory, which said recovery after a hernia operation could take weeks.
You may need to take some notes, okay?
But 45 years later, the Shouldice Hospital is still challenging that theory. Straight after their operation, patients walk to their wheelchairs. Within a couple of hours, they go for a stroll. And so successful is the hospital that more than 50% of its patients come from outside Canada. It's a January night at Toronto's Royal York Hotel, and yet another convention. It's not the Elks, it is not the Kinsmen, it's a hernia reunion. It is in fact the 39th annual reunion of Shouldice Hospital patients, and 1,500 of them have turned up. Apart from some nurses and a handful of women patients, this is an all-male affair, and they all have only one thing in common. They had their hernias fixed at Shouldice. The demand for tickets is so great, there's no room for wives. The ladies may, however, sit uncomfortably in the balcony and watch their husbands eat and swap hernia operation stories. One of the first things you notice about Shouldice is that it seems more like a country club than a hospital. Set in 135 rolling acres, it's built around a large country mansion once owned by a newspaper magnate. Last year, some 7,500 patients passed through the assembly line operating rooms at Shouldice. Over the years, the hospital has seen hernias from all walks of life, from farmers to film stars, plumbers to politicians. Among the rich and famous who've walked through these gardens, a former governor of Michigan, the actor Chuck Connors, the opera star John Vickers. Many more have come and gone anonymously. Their secrets safe with Shouldice.
I'm Dr. Obney.
How do you do?
Chief Surgeon Dr. Nicholas Obney examines Tim Harviton, a manager of a bank north of Pittsburgh, Pennsylvania.
I'm going to just step on a scale here, please.
Tim has 2 hernias, one a recurrent.
164.
After his first hernia, he spent a week in a U.S. hospital and 2 weeks at home in bed. The average stay at Shouldice is 72 hours. After his examination, Tim will change in his semi-private room and become part of the club-like atmosphere of Shouldice.
One of my customers at the branch where I worked at a year ago had come in to me for a loan. And just through the normal conversation, I asked what funds were to be used for, and he told me he was coming here for an operation. Surprising, the more people that I have spoken to, and my wife too, we have found that there have been other people that were familiar with this and have come up here.
At lunch, the new arrivals meet and get to know other patients who've already been under the knife. Most will know each other for only 3 days. Yet the common experience will lead in many cases to the kind of friendship which usually occurs to men who've shared the same trench during wartime. After lunch, Nurse Bridget Killian, a bit like a genial staff sergeant, tells the batch of 20 new patients who are going to be operated on tomorrow what to expect.
No breakfast. Nobody gets breakfast. Late cases, all of you can't go early in the morning, so late cases will get something to drink, a coffee or tea. You will survive, everybody does. Now when you come back from your operation tomorrow, some of you 2 hours, 3 hours after you come back, you're ready to sit up on the side of your bed. When you think of getting in and out of bed, always try and do it in a little rolling motion, keeping everything together. Don't suddenly throw your leg out because that's going to hurt if you do. So you try and keep everything together. That's the easiest way. It's going to take a couple of days before anything starts moving along in that bowel after your operation. You will get laxatives, you get oil, you get milk magnesia, and as a rule you go to the bathroom before you leave here. If not, you'll certainly go when you go home. You are going to go again, folks. You may think you're never going to go, but you are going to go again. I can assure you it will happen.
Dinner is a little more subdued than lunch. Nobody here is really ill. A hernia is hardly a life-threatening affliction. It's usually a source of amusement for those who don't have one. But the knowledge that one's stomach muscles are going to be sliced open tomorrow tends to concentrate the mind. Tim's operation is early in the morning. He soon discovered there really is a hospital somewhere in the basement of Shouldice. This first operation is to repair the hernia that happened 8 years ago. It's an inguinal hernia caused by a tear in the abdominal wall in the groin area, suffered mainly by men. They can occur in a variety of ways, from a sudden sneeze to helping a friend lift a piano up a flight of stairs. It's a particularly weak spot in men because that's where the cord to the testicle passes through the abdominal wall.
Why are very thick solutions to handle if you think that it's great?
Fixing up other surgeons' work is a familiar procedure at Shouldice, and it's here that the difference between the Shouldice technique and that used elsewhere becomes apparent. Dr. Obney is repairing the torn muscles in Tim's abdomen with 6 continuous layers of stainless steel wire, 2 rows per muscle layer. The steel sutures are stronger and last longer than traditional synthetic sutures, and the area around the hernia is so strengthened, likely for him to ever need repair again in his life. Shouldice's success rate may well be the highest anywhere, which is why doctors around the world send their patients here. After his operation, he walks to a wheelchair. He walks to a wheelchair.
真係慘啊！行嗰段路，痛得又傷。切腹咯。
He'll rest for a couple of hours, and then, whether he likes it or not, he's told to get up and get moving. Because the patients have had only a local anesthetic, their bodies recover faster, and the more they exercise, the more the pain diminishes. They are not permitted the luxury of lolling around in bed and moaning in pain. Instead, there's the slow, purposeful Shouldice shuffle. And there's time to swap Dr. Bruce Shouldice, son of the hospital founder, believes that there's more to surgery than surgery. Just making the patients happy.
A lot of the patients probably enjoy themselves. They meet people from quite a number of different areas, and they mix farmers with businessmen and so on and so forth. And I think they're pleasantly surprised, rather than in many general hospitals, you go there, you're in a room, and you stay there. Sure, you can wander around to some extent, but then everybody's got different problems. Here you've got the same common problem, and there's a lot of comparing goes on.
Have you had offers to franchise this hospital?
Yes, we've had offers to franchise. And no, we've said no continually, and it's, I don't like to use the commercial term, but it's quality control. If we did start another hospital, and we've certainly been encouraged to do it frequently enough, it would have to be the same. And I really wouldn't trust it to others.
The emphasis on exercise is relentless. Not only are the patients encouraged to stroll the grounds in summer and the corridors, they can walk around the building slowly and retrieve their golf balls. Very slowly. And inside there's a pool table. None of these pursuits is what you would call demanding, but they all require movement. And nothing brings people together more than taking part in Mrs. Killian's musical aerobics.
1 line, 2 lines, 3 lines, 4 lines, 5 lines. Okay. I stand up there. Is that okay from the floor? Okay, now everybody up there, put your arms up.
It's not Jane Fonda's workout, but here too, there is no gain without a little pain.
Okay, put your hands by your side. As you raise your arms, take a deep breath through your nose, right to the bottom of your lungs. Big deep breath. And out through your mouth. Big deep breath, and continue to breathe, and out.